Hi there, I, Rafael Reis, and my colleagues, Raquel, Shiroma, and Luiz Lima, performed our project in order to show ibuprofen an over-the-counter non-steroidal anti-inflammatory drug life cycle strategic plan. Please feel free to contact us if you have doubts about our presentation. Our emails are on the screen. The development of ibuprofen was based on the need to have a safer form of aspirin without its gastrointestinal effects and also without the serious adverse effects of the phenylbutazone and corticosteroids, the principal anti-inflammatory agents available in the late 60s. We found some papers regarding the early clinical development on PubMed database. However, none of them have the text available, and neither the abstracts with the main findings. So we searched for these papers on Brazilian medical libraries and didn't find them. These are some papers that we found, but we found just the title and the authors, but we didn't find the content of the papers. These are performed in the late 60s and in the early 70s, and most of them are double-blind clinical trial and assessing the treatment of rheumatoid arthritis and pain. These ones are other papers that are in the same context. All of them regarding anti-rheumatic drug, and some of them comparing with the aspirin. So we found this paper that assess the dose rangings, and this paper was performed at University of Newcastle Dental School. The aim of this study was evaluate the efficacy of 3 single doses of ibuprofen after the third molar surgery. 148 subjects, 78 women and 70 men were evaluated. The exclusion criteria was history of asthma, drug of alcohol misuse, or those who required prophylactic antibiotic or corticosteroids treatment. Oral temazepam was given 2 hours before anesthesia induction with propofol. After the surgery, patients recorded their pain intensity using a visual analog scale. After 2 hours of the surgery, patients received tablets of 200, 400, or 600 milligrams or dissolved in water 200, 400, and 600 milligrams of ibuprofen. To blind the study and to randomize it, they used the double dummy technique that is vastly used in these clinical trials. After the blinding and the randomizing, the visual analog scales was assessed 13 times in the next 6 hours. And the authors, they concluded that both soluble and tablet formulations of ibuprofen provide effective pain control in the early postoperative period after removal of impacted third molars. There is little analgesic advantage in increasing the dose to 600 milligrams, and only minimal benefit from using a soluble formulation of the drug.